question you are trying to address is why is it that we have those different classes? So this is where the biomarkers come in. So when we talk about biomarkers, we mean they are molecules. They are small molecules within our bodies. I am the names they call me Dr. Charles Katodrago. So I've been involved in a number of research projects as a principal investigator and also as a co-principal investigator. What I'll talk about is what we call the COVID-19 biomarker project. And this project is being supported by the government of Uganda through the Presidential Scientific Initiative on Epidemics. This initiative is new, but the resources are coming from the Ministry of Science, Technology and Innovations.
My name is Anna Chitibwa and I am a laboratory technologist here at Makerere University, College of Veterinary Medicine, Animal Resources and Biosecurity. We are currently running a project where we are looking for markers that will help us classify this disease. So we are looking at different groups of the COVID-19 disease. We are looking at those that fall under controls, those that fall under asymptomatic, symptomatic and severe. We're trying to look out for markers that will help us to classify that people actually who fall under this group have a certain marker that's in high concentration. So we've already classified our groups. We've picked serum samples from these groups: controls, asymptomatic, symptomatic and severe. And so far we have tested the asymptomatic and asymptomatic group. We've looked out for angiotensin, homocysteine, D2 dimer, and now we are heading for cytokines to see which concentrations of these markers are high in which group.
The other goal is also want to develop diagnostic kits that can help us. We call this prognostic markers, such that we can predict early who is going to become severe. Because the problem with health facilities is that they are becoming overwhelmed because of the large number of patients that are coming in and day out. But of course, with the COVID, you have seen that some people can be managed at their homes. You don't need to go to hospital. You only go to hospital when the condition has become severe. So if we can predict early who is likely to become severe and who is not, then of course we can tell the biggest population of people that please do not come to hospitals. You can be managed at home. Because you can see that there will be people who are suffering less severe or mild cases, but they are occupying space in an already overstretched hospital setting, whereby you would keep these beds, the oxygen parameters, the ventilators for individuals who need them the most. So what we are doing now is we are doing laboratory validation. After the first thing you do in biomarker is to identify the marker, which we have done. So now we are doing what we call biomarker validation. Biomarker validation is that you test them in samples of people who have the disease in large numbers, not in only few but large numbers, because that gives you a leeway to know what is going on.